Let me ask you something directly. How many prescriptions are you taking right now? 2, 4, 6. Now, let me ask you something your doctor may not have had time to ask you. Do you know what those prescriptions are doing to your kidneys? I'm Dr. William Collins. I've been a surgeon for over 20 years, and I'm making this video because I keep noticing the same pattern in my patients. Kidney injury that didn't come from disease, didn't come from bad luck, but came from medications. Medications people were using faithfully, trusting completely for years. Today, I'm giving you 5 specific pills that evidence has shown can harm your kidneys after 60 and 3 practical solutions you can bring to your very next appointment. But here's what I need you to understand before I give you that list. If I just read you 5 drug names right now, that information would be nearly useless. What will truly protect you is understanding why these medications affect kidneys over 60 differently than they affect a younger body. Once you understand that, you'll know exactly what to say to your doctor. Right now, leave a comment below. Tell me your age and how many medications you're currently taking. Now, let's get into it. Let me tell you about Linda. Linda was 67 years old, a retired school teacher from Ohio. 31 years in the classroom, never missed a day. The kind of woman who took care of everyone else first. When she retired, she finally had time for her grandchildren, her garden, her life. But arthritis had other plans. Her knees and hips had been bothering her for years. Her doctor prescribed ibuprofen for the flare-ups. At first, it was occasional. Then, the flare-ups became more frequent, and the ibuprofen became daily because it worked, because it let her move, because it let her be the grandmother she wanted to be. She was also on lisinopril for blood pressure. 5 years, never missed a dose. She was by every definition a good patient. About 8 months into this routine, she noticed things. Swollen ankles, deep fatigue that sleep didn't fix, difficulty concentrating. She told herself it was just aging. It wasn't. Routine blood work changed everything. Her doctor called and said her creatinine levels were elevated and her kidney function was concerning. Linda sat in her kitchen after that call trying to understand what she had done wrong. She had taken every medication exactly as prescribed. She had shown up to every appointment. Her nephrologist explained it. The ibuprofen she was taking daily was constricting the blood vessels that feed the kidneys. The lisinopril, which relaxes blood vessels to control blood pressure, was compounding that effect. Together, they were creating what kidney specialists call a double hit, a combination that significantly increases kidney damage risk, especially in adults over 60. Linda looked and said something I think about often. I was doing everything I was told. How is this possible? He said, Linda, being a compliant patient and being an informed patient are not the same thing, and you deserve to be both. Her kidney function stabilized after the medication changes, but not fully. Some damage was permanent, and her nephrologist told her something that is the entire reason I'm making this video. He said, if we had caught this 6 months earlier, we would be having a very different conversation right now. So, what was actually happening inside Linda's kidneys, and why does it matter for you? Here is something most people over 60 have never been told. After age 40, your kidney filtration rate, called GFR, declines by approximately 1% every single year. That's just normal aging. By the time you're 65, most adults have already lost 25 to 30% of their peak kidney filtering capacity. And yet, most people feel completely fine. No pain, no symptoms, nothing. The National Kidney Foundation has documented this extensively. Your kidneys have enormous built-in reserve, but that reserve has limits. And here is the critical point. The medications deemed safe for you at 45 were not necessarily tested on people who had already lost a quarter of their kidney function. Research published in JAMA Internal Medicine has highlighted this gap repeatedly. What clears safely through a younger body can accumulate and cause damage in an older one. Think of it this way. Your kidney function is a water tank. When you're young, the tank is full. As you age, the tank gradually gets smaller, not because anything is broken, just because that's what time does. Now, add medications that put extra pressure on that tank every single day. When the tank was full, there was plenty of room. When it's already at 70% capacity, that same pressure hits very differently. Now, here's where it gets critically important. Kidney specialists have a name for one particular dangerous combination. They call it the triple whammy. An NSAID, ibuprofen, or naproxen combined with an ACE inhibitor or ARB, which are common blood pressure medications, combined with a diuretic, a water pill. 3 medications, each prescribed for legitimate reasons, each considered appropriate alone. But together, research published in the New England Journal of Medicine has documented that this combination significantly increases the risk of acute kidney injury. And here's what makes this so relevant to you right now. These are 3 of the most commonly prescribed medication types for adults over 60. Millions of Americans are taking 2 or even all 3 simultaneously, often prescribed by different doctors who each have incomplete pictures of everything else the patient is taking. One more thing before I give you the 5 pills. The kidneys are what doctors call silent organs. Early decline produces almost no symptoms, no pain, no obvious warning signs. Most people feel completely fine until function has dropped to 40 or even 50% of normal. By the time something feels wrong, significant damage may already have occurred. This is precisely why knowing which medications to discuss with your doctor matters so much. Leave a comment right now if any of this is matching your situation, and please subscribe and hit that bell icon because the most important part of this video is still coming and I don't want you to miss it. Now, let me give you 3 more patient stories because the 5 pills affect people in very different ways, and I want you to see yourself or someone you love in one of these. Gary was 71, a retired electrician from Texas. For 6 years, his doctor had been refilling his omeprazole Prilosec for acid reflux. It worked. Refills were automatic, and nobody flagged it for review. What Gary didn't know was that research published in the Journal of the American Society of Nephrology has linked long-term PPI use to a kidney condition called acute interstitial nephritis. An inflammation inside the kidney. Gary's GFR had been quietly dropping for years. Once identified, his omeprazole was discontinued. He was switched to an alternative, and his kidney inflammation resolved. But, he told his daughter afterward, "I assumed because my doctor kept refilling it, it was safe forever. I didn't know there was a difference between short-term safe and 6 years safe." Susan was 68, a former office manager from Florida. She took Aleve, naproxen, every single morning for shoulder arthritis. She never mentioned it to her doctor because it genuinely didn't occur to her that an over-the-counter painkiller needed to be reported. It's just Aleve. You can buy it anywhere. But the FDA labeling on NSAIDs includes warnings about kidney risk with long-term daily use. Warnings that are easy to miss when you're simply trying to get through the pain. Susan's situation was caught early through routine blood work. Her doctor asked if she was taking any anti-inflammatories. She mentioned the Aleve almost as an afterthought. Her doctor paused and said, "Susan, how long have you been taking that every day?" The naproxen was stopped. She was switched to topical diclofenac gel. Her kidney function stabilized. Barbara was 63, recently retired, seeing 3 specialists, a cardiologist, a primary care physician, and an orthopedic surgeon. Her cardiologist prescribed a diuretic. Her primary care doctor prescribed an ACE inhibitor. Her orthopedic surgeon recommended naproxen. 3 doctors, 3 separate prescriptions, none of them aware of what the others had prescribed. Barbara ended up in the emergency room with severe fatigue, confusion, and almost no urine output. Her kidneys had gone into acute crisis, a textbook triple whammy. She recovered fully because she got help quickly. A geriatrician reviewed her complete medication list and restructured everything. All 3 specialists now communicate through a shared coordinator. Barbara said afterward, "I thought having 3 specialists meant I was getting the best possible care. I didn't realize that 3 specialists with nobody looking at the whole picture was actually a gap. That gap is preventable, and now you know to look for it." Leave a comment right now. Does any of these stories sound familiar? Write "This is me," or tell me which story you're going to share with someone you love. Subscribe and hit that bell icon if you haven't already. Now, let's get to the 5 pills. Here they are. You've been patient. You understand the context. Now, let's make this count. Number 1, NSAIDs, ibuprofen and naproxen, Advil, Motrin, Aleve, for short-term use in healthy people, largely appropriate for adults over 60. Taking them regularly, daily, or near daily, the risk profile changes significantly. NSAIDs block prostaglandins, which keep the blood vessels feeding your kidneys open and relaxed. When those vessels constrict, blood flow to the kidneys drops. In a young person, the body compensates. In a 68-year-old already at 70% kidney capacity, sustained constriction causes damage. The risk multiplies when you're even mildly dehydrated, when you're sick, or when you're also on blood pressure medications. The American Journal of Kidney Diseases has published extensive research on this relationship. Number 2, proton pump inhibitors. Omeprazole, pantoprazole, esomeprazole, Prilosec, Protonix, Nexium. Short-term use is generally appropriate. The concern is long-term use, months to years, which has become common because these medications work well and refills are often automatic. Research in the Journal of the American Society of Nephrology and the American Journal of Kidney Diseases has linked long-term PPI use to both acute interstitial nephritis and increased chronic kidney disease risk. If you have been on a PPI for more than a year, this is worth one specific conversation with your doctor, not to stop it abruptly, but to ask whether it's still necessary. Number 3, certain antibiotics, specifically aminoglycosides, gentamicin, tobramycin, and vancomycin. These are primarily used in hospital settings. I include them because many people over 60 who have been hospitalized may have received these medications without knowing it. They are directly toxic to kidney cells, and seniors with reduced baseline kidney function are at significantly higher risk. If you've been hospitalized and received 4 antibiotics in recent years, it is entirely reasonable to ask your doctor what you were given and whether your kidney function was monitored. Number 4, lithium. Effective for certain mood disorders, used by many people for decades, but lithium has a narrow therapeutic window. The difference between a helpful dose and a harmful one is smaller than most medications. Long-term use is associated with chronic tubular interstitial nephritis, gradual kidney tissue damage that develops without symptoms. The intervention is not necessarily stopping lithium. It is consistent monitoring blood levels and kidney function tested regularly. If you or someone you love is on long-term lithium, ask specifically, is kidney function being checked and how often? Number 5, contrast agents used in CT scans and imaging. If you've had a CT scan with contrast, you received an iodinated dye injected intravenously. For most people, it passes through without problems, but for adults over 60 with reduced kidney function, which is most adults over 60, contrast agents can cause contrast-induced nephropathy, significant kidney stress during the filtering process. This risk is entirely manageable when it's known in advance. Prehydration protocols and low-contrast alternatives exist, but they only get applied if your kidney status is flagged before the procedure begins. So anytime you're scheduled for imaging with contrast, tell the radiology team your GFR number and ask, given my kidney function, what precautions will you take? Those are the 5. Now, here are your 3 solutions. Solution 1, know your GFR number. This is the most direct measurement of how well your kidneys are filtering available through a standard blood test. After 60, it should be checked at every annual visit. Above 60 is generally adequate. Between 45 and 59 is mildly reduced. Monitor more closely. Below 45 warrants a conversation with a nephrologist. Keep a note in your phone or a card in your wallet with your last 3 GFR readings and dates. If you've never been told your GFR, call your doctor's office today and ask for it from your most recent blood work. This is your number, you should know it. Solution 2, the medication review conversation. Before your next appointment, gather every prescription, every over-the-counter drug, every supplement, every vitamin, put them in a bag. Set that bag on the desk in front of your doctor and ask 2 specific questions. Are any of these hard on my kidneys? And is this combination safe for my age? And am I on the lowest effective dose given my current kidney function? If you see multiple specialists, Ask your primary care doctor to serve as the medication quarterback, one person responsible for reviewing the complete picture. That role doesn't automatically get assigned. You have to ask for it. Solution 3. Know your safer alternatives for pain. Topical diclofenac gel delivers anti-inflammatory medication directly to the joint through the skin with dramatically lower kidney exposure than oral NSAIDs. Acetaminophen at appropriate doses is generally kidney safe and underused for arthritis. For acid reflux, ask your doctor whether your PPI is still necessary or whether an H2 blocker like famotidine might be sufficient. For imaging, proactively tell the radiology team your kidney function and ask about prehydration protocols or contrast-free alternatives. And for everyone, stay hydrated, especially when you're sick or it's hot. Dehydration concentrates medications in your bloodstream and dramatically increases kidney stress. Now, let me answer the questions I know are on your mind. How do I bring this up without my doctor feeling challenged? Use this exact language. I've been learning about how certain medications can affect kidney function as we get older, and I'd love your thoughts on my specific situation. You're asking for their expertise. That is what a good patient-doctor relationship looks like, and most doctors will genuinely welcome it. I've been on some of these medications for years and feel completely fine. Should I be worried? Feeling fine is not the same as being fine. And I say that not to frighten you, but because it is the nature of early kidney decline that it produces no symptoms. Get your GFR tested. If your numbers are good, you have real reassurance. If they show something worth addressing, you caught it while you still have options. Either way, you're better off knowing. What if my doctor dismisses the concern? You have the right to ask for a GFR test. It's a standard blood test. If your doctor declines without explanation, ask why. And if you remain concerned, a second opinion or a one-time nephrology consultation is entirely reasonable. Advocating for yourself is not overreacting. Are supplements kidney safe? Not automatically. High-dose vitamin C has been associated with kidney stress. Certain herbal products have been linked to serious kidney damage. Excessive protein supplementation over long periods adds burden to aging kidneys. Supplements belong in that bag you bring to your appointment. Let me come back to Linda one last time. About a year after her kidney function stabilized, Linda joined a chronic kidney disease support group, not because her situation was severe, but because she wanted to understand her own health better. She learned her GFR number. She started bringing her complete medication list to every appointment. She asked her primary care doctor to review everything she was taking twice a year. She told her daughter about all of it, and her daughter started asking the same questions about her own medications. That ripple effect, that is what informed patients do. They don't just improve their own outcomes, they change the conversations happening in the families around them. Linda told me, I was a good student my whole life, and then I realized I had never really studied my own health. I think about that line often because it captures exactly why I make these videos. You now know the 5 medications that research has documented as potentially harmful to kidneys after 60. You know why aging kidneys are uniquely vulnerable. You have 3 specific solutions to bring to your next appointment. You know what GFR is and why it matters. You know the right questions to ask and the exact words to use. My father taught me that the most important thing a patient can do is show up informed. Today you did exactly that. Here is what I want you to do right now. Leave a comment with one of 3 things. Comment checking my GFR if you're going to request that test. Comment on talking to my doctor if you're planning the medication review conversation. Or comment sharing with someone I love. If there is a specific person whose face came to mind during this video, then share this video with that person, not to support a channel, but because the person you're thinking of right now deserves this information before something goes wrong, not after. If you haven't subscribed yet, please do it right now and hit that bell icon. I post research-backed health content built specifically for adults over 60 who take their health seriously, and I don't want you to miss what's coming next. Save this video before your next appointment and use it as a reference. You watched this all the way through. That tells me something about you. It tells me you're someone who genuinely cares about your own health and about the people you love. I'll see you in the next.